Okay, so Dave, you injured yourself right there.
Yep.
And that's after a deadlift.
Mm-hmm.
So you didn't feel it during the deadlift, it was directly afterwards. Okay. So I've done all the ligament integrity tests and they're fine. I did rectus femoris test. I did a very basic hamstring test to see if it's working or not. Just bend your leg there. Okay, now resist as I pull. And you can't resist it. Okay. Okay. So we've also done QAT test on your right SI joint, and we found that the right SI isn't working. But the interesting thing is when I started to do the abnormal switching test on him, I started with one device here, and sure enough, he went completely weak. And that's in a visceral reflex point of the colon. So, you know, I asked him if he had any bowel problems, and he said he's just been on a specialized diet. But I checked his meridians, and his large intestine meridian associated with the hamstring is normal. There's no imbalance between the two meridians, so I thought, well, you know, why is that reflex point turning up? So I don't know why. So I went on further to do some more tests on him, and I tested his hamstring, and I tested the medial portion of his hamstring, and he's completely, pull back please, completely strong. When I reach under to the lateral portion of his hamstring, there's no strength whatsoever, so his brain shuts off. So that tends to be that the lateral portion of his hamstrings are not communicating with his brain. So it could be the visceral reflex point is sounding off because of this problem, and this problem could have started immediately after his squat. And if you watch the squat video, you'll see his right knee hyperextends slightly, and that may have caused it, I don't know. We're going to do an injury recall test on his, we know his quadricep is good. So the lateral side's good. Medial, it knocks it out completely. I place it right over where you feel the injury. There's absolutely nothing. So we'll reset we'll do an injury recall on him. We're doing this live, so we don't really know what's going to happen. So that injury recall is down and touch the talotibial joint while touching the medial knee. And I'm just going to put that over here now. Pull back, please. And that's reset. Okay. Be interesting to see if you actually have the medial tibia itself. And you certainly do. Okay, so we'll reset the medial tibia. And now reset, pull back. Okay, so we tested his normal. I'm just curious to see whether the brain is switched on its hamstrings, so we'll put it into the muscle testing on the lateral portion of the hamstring. Yeah, that's completely strong. Okay, so that's strong, so does it test strong? No, it didn't test strong before, so hold there as I pull. And again. You're strong, but you're not completely strong. Because, you know, as a bodybuilder, I can't move you normally. So let's find out if you've actually got an injury recall on the actual muscle itself. So we use the rectus femoris. We'll go over to we've reset the muscle, but it could be an injury recall. It could have been a strain in there. Who knows? Pull back, please. No. Nothing. Okay, so there's nothing there. Before we go any further, it may just take time for that to become normal strength. Let's go back to the colon reflex. We'll use this knee because I've used before. Did it fix your colon reflex? Pull back, please. So there you go. Rather than worrying about you having a large intestine full, which we picked up with the visceral reflex, it's probably that correcting the possibly the injury recall, also correcting the reconnection to your hamstring is what fixed the visceral reflex point. I can't explain it any other way. Let's go back to the hamstring. I'll tell you one thing. I don't know if we've fixed your pelvis completely, so let's check. Pull back. hold it down. Yeah, hold it right there. No, I can't punch it now. Do you feel more confident?
Yeah.
No, I can't punch that. So let's just very quickly go over the SI joint and the chest. One on the conception vessel, one on the SI joint. And we'll bring this knee back into the test and pull back, please. No, that's definitely reset. Just to make sure there's no injury recall in there, we take this one off here, because you could have injured it when you were doing the lift. Now pull back. Oh yeah, that's definitely an injury recall. You've got nothing there. Okay. For a guy who deadlifts over 500 pounds, you can't resist with your rectus femoris. You know your brain's turned off during the test. So now that should be fine now. So we know it's under the SI still. So let's just test. Pull back. Now go. Okay. So that's what was going on. I think the hamstring needed to reset. The pelvis had an injury recall in it, and the knee had turned medially, which we picked up and corrected. And I wouldn't be doing my job if I didn't reset or test your knee to make sure the knee's normal again. Yeah, we've already tested that, it's normal. But what about the ankle? Always test the ankle. And again, yeah. So you have a slight medial talus on that one, okay? Now we corrected it. Okay, the old fashioned manipulation of that would be, and you do have a dropped arch, so you're prone to injuring yourself that way.
Really?
Yeah, you do your talus rules. So I'll just do a medial talus adjustment. There we go. So now you should be okay. Awesome. All right, thank you.
You're welcome.